Good day, Dr. Eraldo. How are you?
Thank you, Graham. I'm fine.
Good.
Thank you.
Good.
Very excited to this interview.
Yeah. Thank you very much. How many times have you visited the IDS?
Well, actually, this is my second. First time that I came was in 2023.
2020.
I was very excited to visit that edition in that time because it was a 100th anniversary. So for me, it's like it has something to do with a special occasion. So I tried to be there. I actually traveled with some friends and we came to the IDS in that time, but I was only a participant. Going around stands and going to workshops here in GC. But it's my first time as a lecturer.
I see, nice. And we're very happy to have you here as a lecturer. I just saw your lecture. You talked about so many products, and we'll get into that. But how long does it take you to get to here?
Well, actually, I am from Lima, Peru. So Peru is located in the western coast of South America. So to get here, I have to travel from Lima to Madrid, and it's a 11 and a half hour flight. And then I got a connection to Düsseldorf.
Yeah.
And from Düsseldorf to Cologne, I took a train. So it more or less 18 hours.
Yeah, that's a long trip. Yeah.
It is a long trip.
But yeah, thank you for coming, and
No, it was a
thank you
pleasure.
for being on the podcast. Our podcast is called All Pulp, No Fiction. I don't know if you
That's a
relate.
good one.
But yeah, so can you talk to us a little bit about the lecture that you gave? Obviously, from what I saw, you're a big fan of MI, intervention. So can you please talk to us a little bit about
Sure.
it? Like, what's the lecture about?
Yeah, well, the lecture was actually orientated to dental restorative materials that are alternatives to amalgam. The main focus of the lecture was trying to update the audience about these Minamata Convention principles in which we are going to be called to stop using amalgam as a restorative material. And for that purpose, you have two very clear objectives. The first one is to promote oral health in order to reduce the burden of dental caries, trying to make those restoration less needed. And when the restoration is needed, we can find other alternatives that might be ideally similar to amalgam in terms of cost effectiveness. So that's a very powerful domain because, we have to try to compare the materials we have now with something that was on the dental market for 150 years.
Yeah.
And it's very difficult to find something that is similar to amalgam, but at least we can now, with adhesive approach and with minimal invasive preparations, we can have alternatives that might be cost effectiveness also in time.
I see. And how popular do you still see the amalgam being in the market? I know
Well-
many countries are trying to phase it out,
Sure.
but from your point of view, how is it going?
Well, from my experience, I was trained in amalgam. I graduated 15 years ago, and I think that it is still used in university settings. I don't know if that's too much present in clinics, private clinics. I don't think so. But there are some countries around the region that is still used in public health settings, in private clinics. But I think that will be phasing down little by little. It will take time, but at the end of the day, it has to be mandatorily removed. So
Yeah,
just a matter of time.
I see. And among the materials, like I missed the early part of your lecture, but I think you were talking about glass ionomers
Yes.
as one of the alternatives to amalgam. Why do you think that these materials are good? For example, if somebody is still using amalgam and you talk to him about the glass ionomers, yeah.
For someone that is used to amalgam, of course, it will be completely a mindset change because when we talk about amalgam, we have all these considerations for the cavity preparation first, because we have to create a retentive cavity in order to place the amalgam, and this amalgam could be retained mechanically. When we talk about adhesive materials, for instance, glass ionomer cement, we can be more conservative in terms of just removing the carious tissue, following the histological manifestation of the dental lesion, so we can preserve more structure, and then we can place the restorative material in a also retentive cavity, but in a different shape. It's not like those plain walls and square
that you need
aspect,
with the
but
amalgam.
following the the zoological development of the caries lesion, that at the end of the day will also be self-retentive. But instead of doing an amalgam, we can use an adhesive material such as glass ionomer cement.
I saw some beautiful pictures and videos that you presented.
Thank you.
How useful are these tools in portraying the idea? Showing how the ions kind of react together and how the bonds actually work. When you show them to students or to the public, does this make them a bit more enthusiastic, let's say, about and trust glass ionomers better?
Yeah. Well, it's always thank you for your comments, and it's always challenging to address a lecture to an audience, and I have this always in mind that we are different. We have different types of learning skills. Some people learn better reading. Some people learn better by hearing. Others by seeing videos. So I try to create a visually appealing presentation that will serve all these learners. I have information that is reading. I have pictures for those who are visually learners, and also the speech that goes together with the presentation tries to reach all these audiences.
I see. And I think we were talking a bit earlier, and you mentioned that you're doing some collaboration activities in the US, in Chicago, and also where else?
Yes.
And so in another parts, University of
Indianapolis.
Indianapolis,
Yes.
right?
Indiana
So,
University.
Yeah. Can you talk to us a little bit
Sure.
about it?
Well, Bájale la fresa is the name in Spanish. It means put the bird down.
Put the bird down.
Yes, it's
Nice.
like an anthem, like
Nice.
an invitation to stop using that much the handpiece and the burr to create cavities and accelerate that repetitive restorative cycle. And this initiative started during the pandemic. Actually, it was a group of Latin American leaders, I will say now, because they thrived through these years, leadering in different areas of dentistry. And the idea of this project was to instill in other colleagues those principles of reducing the caries burden by early caries risk diagnosis, by detection of lesions very early in life or in the initial stage in order to remineralize and postpone the need of a restoration need. And later on, we were able to include one good friend from the University of Indiana. So Indiana University started to collaborate with us a couple of years ago. So we have the support in terms of certification for our course that is a web-based program. And in the second year, collaborating with the university, we transformed this program into a on-site presential week that we call mini residency. The mini residency covers from risk assessment to restorative, but also including the financial component. We have a manager, Paulina, that is in charge of educating clinicians how to make minimal intervention dentistry profitable. So that's a very comprehensive program. We are very proud of it. And about Chicago, this year we also have the collaboration with GC America. So as a complementary program or as an additional program to the mini residency, we have this visit to Chicago that we call the GC Experience, in which some of the participants will be invited to join us in Chicago to visit the factory, to make a couple of workshops there, because you have very, very beautiful facilities in Alsip.
Yeah, I was there last year actually.
Oh, great.
Yeah, it's a very good facility, like you mentioned. And dentists, when they get hands-on training, do you think are these students or like already practitioners?
Well, the mini residency is open for specialists, general dentists.
I see.
Yes.
Do you see many of them embracing the techniques and actually applying them in the clinic?
Yeah, actually, we have a very nice group last year because it was our first edition in 2024.
Yeah.
We have 50 people from all over America, especially Mexico, but we have people from Peru, Chile, Colombia. It was this girl that came from Cyprus.
Cyprus.
She was originally from Colombia, so she speaks Spanish.
Yeah.
But she travels from Cyprus to the States to join us in this first edition. So it was amazing to see how many different people from different origins get together and learn together. And now we see now with social media that we feel closer and closer. We see how these concepts are now translated into clinical practice. So we are very happy to contribute to that change.
Right. And we're talking about glass ionomers for a little bit, but there's also like resin modified glass ionomers and then fiber reinforced composites also. You talked about them and you showed many beautiful lectures. What's the material selection when you are, dealing with cases? This is a question I ask all my guests. There are so many materials to choose from.
Yes.
So how do you decide?
That's a great question. One of the main decision-making trees that I have in my mind is assessing first the carries risk of the patient.
Yeah.
If I have a high risk patient in front of me, I will orientate a little bit the balance towards glass ionomers or glass hybrids. And if I have high loading bearing areas or a big structural distraction, I will be more orientated or more prone to select resin reinforced with fibers.
I see. And
And of course, we can evaluate the tooth itself, right?
yeah.
Depending on how compromised the tooth structure is, we might be selecting one or the other. And it's a decision that we might take even after once we clean the cavity or the previous restoration. Sometimes we give that introduction to the patient saying, well, in this case, I will prefer to use this material, but due to the fact that I am not 100% sure how the tooth will look like once we remove the old restoration and when we clean the cavity, we can make that decision later. But always having that window of opportunity to change our mind in case the structure demands it so.
And in Peru, you said, do patients usually? How's dental health awareness the community in there? Do they usually come with very bad caries, or like, how often do you see people that are really committed to keeping a good oral health for themselves?
Well, unfortunately, traditional dentistry was very reparative. So the traditional Peruvian patient is the one that comes with pain or
When it
with
hurts,
some
they will go.
discomfort. Yes, but once we try to instill in them this concept of taking care of what is already there, once I put a restoration, I also want my patient to be more proactive in cleaning, proactive in reducing sugar intakes, proactive in coming to the office for checkups. And in that way, they also save money. And that's the key element. What is the benefit for them? Well, you don't have to deal with drilling and filling every time you come to the office. Simpler procedures. If something breaks, we can repair it, and that's it. But it's something that has to be incorporated into the educational process of the patients.
Yeah. And one more question about the dental community. I think in Europe there's a lot more direction towards MI. In other parts of the world there's a little bit more, like, let's say, invasive, like they would like to drill, not to put the bird down,
Yeah.
actually take it.
Well, the idea.
How do you see it?
Well, it's a challenging scenario. That's why we are very motivated in our program, because it's difficult to embrace change, and we have been educated in a certain manner, and trying to incorporate this different mindset is quite challenging because I did it like this for 30 years and always work is nothing more dangerous than that phrase. So it's very difficult to change the mindset of an individual. But I think that now more than ever we have a lot of information available for us, not only publications in a scientific style, but also social media. We have YouTube videos, webinars. I mean, if you want to thrive, if you want to learn, you have everything in your at your reach.
Yeah,
So it's just a matter of making that change faster.
I see. In the end, a question that I also ask everyone: if there's a one takeaway from the lectures you give or from the podcast that you want to give to our audience, what would you tell them?
Well, I will say that we have to work together, not only with dentists, but also with other healthcare professionals to reduce the burden of oral diseases. And there's a very nice phrase that I heard from Ole Fegreskov, that is a cardiologist, that he says, we are overtrained for what we do, but we are undertrained for what we should be doing. Powerful.
Very.
It means that we are very good restoring teeth, but this is not needed anymore, or is not going to be ending the problem of dental caries of trauma or whatever. But if we try to incorporate behavioral mechanism, motivational interviewing, teaching others or influencing others to reduce the risk of caries and other conditions, I think that we will make a difference in the world.
See. Thank you very much.
Thank you for the
Appreciate
interview.
you.
I really enjoyed it.
Yeah. Thank you.